Today, I'm really excited to have Dr. Kaveh Safavi and Brian Callis with Accenture Health join us, and they're going to share some of the research they did around digital health gains pre and post COVID. And it is a great discussion. I'm looking forward to having that. Before we get there, I wanted to share some of the things that's going on our social media channels. So a couple things. One, if you want to follow the show and get the clips that we are sharing, the best way to do that is to follow the show on LinkedIn and on Twitter. And we share those clips and we share who was on the show this week and those kinds of things. So this week in Health IT and this week in HIT. So this week in HIT on Twitter, this week in Health IT on LinkedIn. If you want to follow me, I am commenting on the industry. I'm commenting on news stories that are out there, and I'm posting a story a day and just starting a conversation. If you want to be a part of that conversation, LinkedIn is really where that's happening. Bill J. Russell is the way to follow me, and I would love to have you participate in the conversation. So any of those posts, feel free to comment, and I will do my best to continue the dialogue with you. And then I will absolutely share some of that on our Tuesday Newsday show. So stay posted for that. And the other thing I wanted to make you aware of is our YouTube channel is growing significantly. The amount of views, the amount of watch in terms of hours is all going up. We've organized that a lot better, and it's a great resource for you and your team. Great way to stay current. Now, on to the show. Welcome to This Week in Health IT, where we amplify great thinking to propel healthcare forward. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. This episode and every episode since we started the COVID-19 series has been sponsored by Sirius Healthcare. Now we're exiting that series, and Sirius has stepped up to be a weekly sponsor of the show through the end of the year. Special thanks to Sirius for supporting the show's efforts during the crisis and beyond. Today, we're going to talk about how healthcare leaders can make the recent gains in digital health last and go forward. And we have two gentlemen on the show who have done the research around this. So I'm excited to have the conversation. Dr. Kaveh Safavi, the Senior Managing Director for Accenture Health, and Brian Callis, Managing Director for Accenture Health. Welcome to the show, gentlemen.
Thanks, Bill.
Well, thanks.
Good to be here.
Yeah, I'm looking forward to it. And Kaveh, I love the I love the background. I know I said it before the show, but I have to say it again. It's such that is a fantastic office for someone in your organization.
It's a real office, and I like it because it reminds me of places I used to travel before COVID grounded me.
Yeah, and you were one of those like platinum players on one of the airlines.
They miss me. They miss me.
I would imagine. Well, I'm looking forward to this conversation. You guys went out and did the research that we've all really wanted to have happen around this topic of digital health. And we interviewed, like during COVID, 40 some odd CIOs, and we heard things like telehealth. We heard adoption of chatbots. We heard usage of the portals and online scheduling just skyrocket and went through the roof. But we have since heard it come back to not to pre-COVID levels, but come back down to earth a little bit. So I wanted to explore that a little bit with you. So talk from your research, talk a little bit about digital health adoption prior to COVID.
Sure.
Yeah, and hey everyone. So I'll start by just describing what we did with the survey. So for the past few years, we've conducted a survey to understand consumers' wants and needs for using technology to manage their health and healthcare. Our 2020 survey was conducted prior to COVID-19 community spread. What we found was before COVID-19, digital health was stalling. In our last year's survey, we found digital health was reaching mainstream, where a majority of people were stating they were using a mobile health app or a wearable to manage their health or healthcare. In our 2020 survey, we found that had dropped considerably, specifically related to wearables, and ultimately those adoption rates were stalling. Interestingly, younger generations were where we saw the biggest dip, and older generations were kind of holding stable.
Interesting. Interesting. So does it really focus in on just wearables, or are you looking at a lot of different technologies like telehealth and other things to that effect?
Mhm.
Yeah, we looked broadly at a set of technologies. So we looked at to the use of mobile health apps, wearables, um, attitudes and preferences towards the use of chatbots or clinician-assisted machine intelligence, as an example, as well as virtual health as a broader category.
And Bill, to put it in context, if you look, we do every 2 years, and every 2 years the average kept going up. And what happens in the last 2 years is that the seniors, for example, stay at about 1 out of 5, and the younger people were like at 60% or drifting down to 50%, and then sort of in the middle, it's hanging in the 30s. But in aggregate, what you're seeing is a leveling off, which is why we call it a plateau. And that's very different than the previous trend. And then we use the survey to really dig into that and figure out why, in fact, that leveling occurred. And then COVID occurs. So we had to then reinterpret what does that plateau mean, given what we've discovered in the flattening of this adoption curve that's been occurring over half of a decade. So that's really an interesting thing we should talk about.
Yeah. So COVID does hit, and it really does change things pretty significantly. You were sort of mid-study. How did you adjust, and then what did you find as COVID was progressing?
Sure. Brian, why don't you take that?
Yeah. I mean, what we found was COVID forced a surge of adoption in the use of technology to help people with their healthcare. And that was really because of necessity. You know, people needed to shelter in place and stay safe in their homes. As a result, you were seeing clinicians recommending a set of digital technologies as a way to diagnose and treat, as well as manage their health and healthcare.
Mm-hmm.
As an example, if you look at virtual health, you know, prior to COVID, you were seeing maybe 200 visits a week. You know, each system was slightly different. And that skyrocketed after COVID, where, you know, upwards of 10,000 visits a week were coming in per system.
Mm-hmm. In fact, I'll recharacterize that a different way. If you look at the total number of visits in the United States pre-COVID, somewhere in the low to mid-single digits was the number of total visits that were done through a virtual kind of a platform. And in May of this year, when we had the maximum impact of the shutdown and only the COVID cases and emergency cases were being seen in person, the snapshot reports were that we were in the mid-50s of all healthcare being delivered virtually. So that was essentially going from, let's call it 5 to 50. And then we're already beginning to see that number settling back down. And one of the big discussions is, where will it settle at? And our study actually identified 3 reasons for why the rate had been plateauing. One of them had been, if you have a bad experience, you don't use it again. One had been because if your doctor doesn't recommend it because it doesn't fit their workday, you don't use it. And one had been, you don't trust who has the data. COVID specifically addressed the second one because it forced the doctors to actually have to use it. They had no other option. And so what we think is that COVID didn't really address the user experience because the technology was the same technology. And COVID didn't solve for the problem of who has my data. All it did was it raised everyone's awareness of it, but it didn't address the issue of confidence. But it absolutely did drive it into the workflow. And so our sense is that whatever the natural curve it was of virtual healthcare, specifically telemedicine as a component of digital, we definitely brought forward a number of years in terms of how fast it's going to stay. We think it'll settle around a third. Some people think it'll settle at more than that. We'll see.
Well, that's what I'm really excited to explore with you guys. So you gave 3 reasons, one being the physicians, one being experience, and one being privacy. Is that pretty accurate?
That's right. Those are the 3 dominant reasons. Yes.
It's interesting because I'm wondering. I've known this for years because I've sat in front of physicians trying to have conversations around telehealth, and I literally had physicians said over my dead body. And people think, oh, that can't be true. But those are difficult conversations. You're asking them to change their practice. There was financial challenges to doing that. And quite frankly, a digital workflow requires a little different, not only technology, but a different underlying infrastructure to make that happen. And so I see that. I understand what you're saying, that they were forced to. So health systems were forced to put that underlying infrastructure. They were forced to put the technology in, and that really drove it. So if financial systems stay in place and those things are in place, what's going to cause it to come back?
Yeah, so a couple of things happened. In some cases, people were being seen virtually because that was the only available option, but not the best option. So let's just say, for the example, for the case of, it would be great if I could examine you, get your vital signs, listen to your heart, or maybe I could obtain a lab specimen or a culture or something like that. But if that's just too hard to do or not safe, then I'm going to make my best guess based on history and maybe some, show me point the camera at whatever you're complaining about. Let me try to guess. And we see some percentage of that rolling back because it was good enough in the absence of no good alternative, but not ideal. And that is an interesting area for future opportunity, because if people figure out how to do some things virtually that they haven't done before, you can maybe close the gap of the ability to examine someone without them being in front of you. I think that I want to go back though, and Bill, you made the point about how hard it was to get doctors to adopt. We actually saw health systems using the same approach they used for the adoption of the electronic health record. With that level of personal support around the first days of use, literally, where do I put my mouse? What do I click? How do I turn it on? They had to take that approach. But once the doctors got through the learning curve, just as with electronic health records, they started to see some of the benefits of it. And so we think that once they realize they could use it, they're going to see some convenience aspects to it. So in some practices, people are going to go, wait a second, now that I know how, and I've gone through the pain of learning how to use it, this is actually an easier way for me to organize my day.
Yeah, and that's an interesting point. We found that the forced adoption, both for clinicians and consumers, after they tried it, many of them were like, hey, this actually has a use. This wasn't that bad. And now it's figuring out, well, how do we actually integrate it as part of care models in the future?
Mm-hmm.
But one of the things about, you talked about the experience. It wasn't just a natural expansion. It's not like we had, we didn't have Teledoc in place and just expand it and everything was fine. A lot of health systems they were using FaceTime, they were using Microsoft Teams, they were using Skype, they were using, whatever they could sort of throw together, which speaks to that experience. Some people there was an uneven experience in terms of an integrated scheduling, doctors showing up on time, documentation, follow-up, because we threw it together. Did you find some of that in your research?
Yeah, on the prior to COVID, I mean, the area of consumer expectations and just the quality of the experience was a very important thing before COVID. Prior to COVID, a majority of people stated that a bad digital experience with a provider would ruin the entire experience. Now, some of that was relaxed out of necessity, during the COVID environment, but we predict that some of those expectations will come back, and there's going to be a need to really more tightly integrate digital services into existing models and reduce some of the friction that existed out of necessity in the COVID times.
In fact, what's interesting is about half the respondents in the survey said that if they had a bad experience, they wouldn't go back. Yeah. And about a third said if they had a great experience, they would go back. So this gets into this interesting conundrum of which is more important, not having a bad experience or having a great experience. And for some people, each one works. But I think in healthcare, we've learned in general that a bad outcome is far more impactful than a good outcome is in terms of changing people's behaviors.
That's interesting, because people are irrational, and I'm not talking to the broad audience. It's not like I'm Joe Rogan and millions of people are listening to this and they're going to write me. But just in general, it's like, if I have a bad experience at the hospital, if I walk in there and I meet my doctor and it's a bad experience, where I'm going the next time for care? I'm going right back there. That's my primary care doc. That's my insurance. Most likely I'm not going to change. But if I have a bad digital experience, the heck with this. I'm going right back to the office. But you wouldn't have the other. I had a bad office experience. I'm going to digital.
Right. Well, we have some interesting data around who trust from an outcome perspective, and patients still trust their clinician. 70% place the greatest amount of trust in the healthcare they receive from a clinician, and whereas from a digital perspective, that's more like in the 30s. We haven't gotten to the place where people are comfortable on a equivalent basis between the two. And that's why I think the important thing to think about digital health is it's really a tool that expands and augments the formal care system. It creates optionality for certain things. It's not like we're going to go from one to the other. It's really that digital is going to become part of the way we do care and allow people to have options in the way that makes sense for them.
Yeah, I want to talk about this privacy and security, and we focused in a little bit too much on telehealth because, I mean, there is this remote patient monitoring. We're seeing Mayo really drive this forward. We're seeing other systems, especially with chronic conditions during COVID, became very creative in terms of providing some devices locally. But a lot of that comes back to privacy and security. What are we seeing? What are we hearing across the different demographics about privacy and security?
Brian, I'll let you take that.
Yeah, as it relates to privacy and security, you know, there's really a big opportunity to establish trust, and there's a lot of concern related to who is a trusted source of your health information. As you can imagine, the primary, you know, the source of trust that exists is with clinicians and providers. And there's more skepticism and less trust when you look at some of the new entrants into the healthcare space, whether it's the large tech platforms or other retailers. In general, this kind of signals the need to figure out how do you communicate kind of how you are being a good steward of people's data and how you use that go forward to build trust.
Mm-hmm.
Well, let me ask you this. So in my local market, the health system is a trusted name. You know, it's quality. And you know, my neighbors work at that health system. They're trusted. But Apple's also a trusted name. So are you finding people trust Apple with their data more than they trust their local health system? And given this week, you know, we're recording this in a week where UHS has been compromised, Nebraska Medicine's been compromised, there's just a number of systems that are getting hit with ransomware and those kind of things. Is that playing a role in how people view their privacy and security of their data?
I think there's two different dimensions to that statement. One of them is around privacy and one is around security. So on the issue of security, meaning who's going to protect my data from getting stolen, interestingly enough, people generally believe that the delivery system is the best at protecting their data from getting stolen. And all of our empiric research suggests that they're the worst at protecting the data from getting stolen. And they generally would place the least amount of trust in the government in protecting their data from getting stolen. But the truth of the matter is that is the best entity to keep your data from getting stolen. The different issue on trust is who's going to do the right thing with my data? Who is going to use my data for a good purpose? That's where we get into complicated issues about, is someone going to sell my data to someone else that's going to try to make money off of it or market things back to me? That's where we start to get into trouble when third-party companies who are not providers have my data, because I don't actually know what their business intent is. And so we're not talking about stealing. We're talking about purposefully using it in some fashion. And that's where I think the big tech companies have some work to do.
And interestingly, you know, when we looked at that, younger generations did have greater trust in tech companies and retailers than older generations to provide health services. However, an interesting thing I think in our data is Gen Z, you know, has an interesting pattern where it isn't as strong of trust relative to millennials and Gen X. So that's something we're going to be watching in the future.
Yeah, expand on the demographics a little bit. So I want to look at the demographics in two directions. I want to look at, you know, the demographics of people using it. I also want to talk about the clinicians. Are we seeing adoption? I don't know if you break it down in this perspective, but adoption for older physicians and younger physicians and those kind of things. But let's start with just the general population, digital health adoption. You touched on this earlier, but yeah. What are we seeing in terms of just broadly across the board is, you talk about Gen X and when we talked about them, we talked about the young invincibles and then the chronic patients. Right. These are two very different categories. Is it better to look at it that way, or is it better to look at it based on the traditional demographic breakdowns?
The way I think about it right now, the cohorts that are the most natural are the baby boomers and older, so call them 56 years old and older. And then you see the Gen Xers that sit between their 40 and mid 50s. And then you see the younger cohort, which Brian made the point, the very young, the people, the people under the age of 25 are actually different than the people between 25 and 40. So what we see, for example, is if you're a baby boomer, and this is actually, I used to talk about this where the older people were the post-baby boomer, and then I realized I'm a baby boomer. I'm in the older generation now, and every data set I'm considered older because baby boomers are older. They're sitting in that kind of 1 out of 5 range for using these kinds of technologies. And then if you go to the Gen Xers, so the people in their 30s and their 40s and early 50s, they're sitting more in the mid 30s, 30 to 40% range. And then when you go under the age of 30, you see, and this is all technologies put together. It just to sort of think about it as digital in totality, wearables, apps, virtual healthcare. When you get to the younger than 30, that's where you start to see 50% plus using something for digital. And then what Brian's point is that the issue of who do you trust with your data is interesting because in that young group, the very young, they're just as skeptical as the middle-aged people as to whether the data is going to be used and monetized in some fashion. So they still use it, but they have a much keener awareness of the fact that they're trading their data for something and they're not exactly sure how it's going to get used.
Is there a breakdown by doctor by type of practice or complexity of their practice or by age in terms of their adoption of digital health?
Yeah, our studies didn't take on the doctors. It was strictly through the lens of the consumer. But I will tell you that when you look at the doctor side of the equation, it is more complicated than you think because the workflow issue confounds the discussion. So if you were to look at doctors as users of digital technologies, not technologies for work, doctors are actually some of the fastest adopters of digital tools and toys in their life. Look at, for example, the introduction of an iPad as an example, or an iPhone. They used it. They were one of the fastest classes to use, even for just their daily life. I think the challenge has been that digital health technologies don't fit into the workflow. And because they don't fit into the workflow, you get very different kinds of adoption. So if you're primarily a hospital-based doctor, you might get one experience. If you're an office-based doctor, you might get another experience. The act of having to type data in has been such a drag on productivity that it's really caused a lot of doctors to just hold off on using technology in their workflow until they can solve for that problem.
All right, I want to get to what will make digital health stick. I mean, one of the reasons I think a video visit makes the most sense is I can sit here and be typing right now. I can be taking notes on this, and it would appear to you that I'm looking at you. Whereas that was one of the biggest drawbacks in going to an office, that they were staring at a computer while you're sitting over here. And we've done a lot of things to enhance that. We have Nuance and we have other types of technologies for voice and whatnot. But still, there's that impersonal aspect of it. Whereas with this, I could be looking at it. But I think the thing everybody wants to, what did your findings show in terms of making digital stick moving forward? What do we need to do to really see those gains plateau at a higher level?
One key thing we need to do to make digital adoption stick is really leverage the trust of clinicians to get those recommended and trusted recommendations to consumers. What we found prior to COVID is a majority of people really wanted their clinician to recommend quality solutions. Like over 50% were like, I really would like, that trusted recommendation of what's good versus not good to help me manage my health. But only 11% of people were receiving that type of recommendation from their clinician. Now, what COVID did is now you had, out of necessity, recommendations were coming for clinicians to use a collection of digital tools to help people stay safe and healthy, in the safety of their homes. So the question is, well, how can we, continue that momentum of that trusted recommendation and referral from clinicians to consumers?
Interesting. So, and I think we knew this. I mean, the physicians are a extremely important piece of this puzzle. They are trusted. When your physician tells you, hey, here's your prescription, go to the pharmacy, you do that. And one of the things I I've said a couple times is, very few people have seen me naked. My doctor has seen me naked. It's like, it's that level of trust. I mean, we have a close bond. So when they say, hey, I'm going to use telehealth for this visit, don't worry about it. It's pretty common. It's just a follow-up. I'm going to trust that recommendation. That is probably the leading indicator of people's use, isn't it? I mean, it's the physician's recommendation.
Yep, agreed. It's also important to think of the other side of the equation, as Kaveh was alluding to earlier. Kaveh, do you want to talk about just kind of the workflow integration and how to make that work?
Yeah, because, and you made this point, Bill, if there's no natural way to fit it into the day, for example, then it becomes a distraction to the way the doctors are working, and everything from, do I go between do I have all physical visits and virtual visits, or do I go between? And what happens if I decide in the middle that I have to order a test or I need to examine you? And so the more that we can address those, the more likely it is that they're going to use it without it being a distraction to the way they do their work day. So, there is a lot of that side. And then the other side, and we saw this with the forced adoption of virtual health, is the technology on the patient's end isn't perfect and seamless. And if you talk to clinicians, they'll tell you what percentage of their essentially a telemedicine visit with video bombs out and becomes nothing more than a phone call, because the patient side, they just can't figure out how to make it work, or they can't get connected. So you've got, let's call it, workflow issues on both sides of this equation in order for everything to try to work right. And I think that to Brian's point, people were forced to use it. They saw some of the benefits, but they also see some of the warts. And the ability to get it to stick is directly related to now going in and trying to make those things better in order to take advantage of it. And I think what you're going to see is a split. You're going to see a group of physicians and providers who recognize that actually a physical digital blend is a more optimal way of providing care. I can allocate my resources better. My doctors can actually see more people without adding more doctors. They'll make the investment. Others will look at it and say, you know what, I've got an office. I've already paid for it. I've got staff. I don't really need to go to the effort of trying to sort all that stuff out. Just come back in. And so you'll see some percent slide back because they're not ready to make the additional investment. And then others will see the return on investment in the future and continue down that path. They'll take advantage of the accelerant. So I expect to see separation of behaviors post-COVID in terms of who makes the investment to persist and who basically rolls back.
Yeah, this whole concept of care at a distance, I think, is going to be something we look at as a COVID-generated thing. We've talked to health systems where even within the hospital, they're limiting the number of touch points, not only with infectious, but with other patients as well. Okay. And they're finding ways. I would assume, so that would be one aspect. If I were making the case to physicians today, that would be one aspect of, it's safer in some cases to do care at a distance. And then the second I would make is, look, we've been talking about quality of life and getting you home by 5 o'clock for a long time. How about we get you home by noon? You have office hours during the week that are, 8 a.m. to 12, and the rest of your visits are, telehealth from home, because there's no viable reason for you to be. We could really make again, a lot of this depends on the financials, the reimbursements, and a lot of it depends on the tools and technologies and the workflow as we talk about. But if we can solve those problems, we can actually, do rounding this way. There's a lot of things we can do with these technologies, as we've proven during COVID, I think.
Yeah, we've written
Go ahead, Kaveh.
We've written specifically about the fact that physical distance as a requirement and a benefit is now in the calculus for virtual. It used to be that you thought about virtual healthcare and you had to do a return on investment, and it was strictly either access preference or financial. Now, safety is a new return on investment calculus, because I think our society is now accustomed to the concept, because of this pandemic, that infection spread and separation is one way to control it. And the longer we deal with this pandemic, the more that will get burned into our psyche as a way of doing work. Just like physical security became part of our mentality after the 9/11. Even though we don't have continuous acts of terrorism, no one would expect physical security to be absent in a number of settings. It's just taken for granted. So this distance and disease contagion gets baked into the way we think about healthcare, maybe the way we think about travel, the way we think about hotels. All these kinds of things suddenly have to deal with physical distance and contagion as just a normal part of doing business. And that gives doctors the opportunity to do this. Waiting rooms. We're seeing health systems now say, I eliminated the waiting room for COVID, but if I really think about it, who needs a waiting room? And they're actually redesigning the office experience to eliminate the waiting room for everybody forever into the future.
And Kaveh is really pointing out the opportunity. And this is an opportunity that we call out in the report. And this really creates an opportunity for healthcare enterprises to not just think of, am I adding digital or adding a virtual channel to connect? It's really, how do we rethink the care model? How do we rethink the care model to blend digital and physical, to change the nature of different roles being incorporated in that to address many of the items Kaveh mentioned?
What are some other things that we need to take into account in order for these digital gains to stick? I don't know which one of you wants to answer that.
Yeah. One important thing we need to consider as digital increasingly becomes part of care models is the digital divide. And that's because consumers are not benefiting evenly from digital health. We need to think through who has access to broadband access, other forms of technology, and how do we ensure equity and equitable access to the technologies to enable digital care models.
It's interesting. I had that conversation on social media just this week, because one of the things I've now said twice on social media is, if the government wants to fund something, one of the things they might want to consider funding is getting everyone a cell phone, because that's in a data plan, because to a certain extent, I don't know how people function anymore. I mean, that's how we look for jobs. It's how we get directions to things. It's how we find a doctor. It's how we visit with a doctor. There really is. And, broadband access is one of those really challenging topics to talk about. Everyone feels like the government should solve this, but it feels to me like SpaceX is going to solve this. They're going to. I mean, there are some commercial as well as government ways that we can get everyone broadband access. But at the end of the day, if I don't have that device that gives me that is the endpoint for that, I mean, you're seeing those divides. Are there solutions out there? Are people talking about how that is going to be solved?
Yeah, I mean, I think it's interesting because on one hand, digital actually solves an access problem that existed before digital technology. It makes it possible to reach distances that you couldn't reach, or to spread out resources in ways that you couldn't spread out, or maybe break the link of time to two people can't be in the same room at the same time, but they can have a conversation. So arguably, digital has improved access, but it doesn't guarantee access, because at the end of the day, you still need the technical ability to interact. And so, for example, in some developing countries where there is no broadband connectivity for that very last mile, you're seeing interesting models where you take a layperson, train them a little bit, and then give them a smart device. And then they can physically go into a setting. In fact, it's even being used in some low-income communities in the United States, where a local healthcare worker with a smart device essentially closes that last mile of digital access for some people.
We also see this as a unique room for collaborations, and we're starting to see some of these materialize in the market today. So recently, Centene has announced a collaboration with Samsung to distribute phones for free to people of need. And we're seeing things like that and different ways of trying to address the gap.
Yeah, let me close on that. This has been a great discussion. I really appreciate you guys coming on. And at the end, I'm going to provide some information on how to access the report. And I think it's a must read. Who is, I'm looking at things, and I'm constantly talking to healthcare systems about being disintermediated, right? Allowing people to come between you and your customers. Now, there's a lot of things in terms of networks and whatnot that require people to keep coming back, but we keep seeing these moves by players, acquisitions, and just little pieces that organizations keep getting in between health providers and their customers. Providers, payers, retail, tech companies. There's a lot of movement here. it, digital is probably one of those ways that people can really disrupt, or we know that they can disrupt the market. Who's going to lead the way in terms of digital disruption of healthcare, do you think? This may
Brian,
not be in the report. This might just be an
That's
opinion.
okay. Yeah. Brian, you want to give your thoughts and then I'll give mine?
Yeah, I think the opportunity to lead the way is coming from, incumbent health organizations, and really those that are seeing the current learning as a way to rethink care models and how do we both deliver care differently and finance care differently. In many cases, that will come also through collaboration with many of the non-traditional entrants that are entering in to the market as a way to kind of complement to create a new ecosystem.
Mm-hmm. And Bill, the way I think about it, to add to that, is I think you have to separate out the technology from the sponsor of the technology. And when you ask that question, clearly technology companies will build capabilities. But the question as to who's going to own and use that technology is, I think, wide open right now. And honestly, it's for the delivery system to lose. Because what we're seeing more and more of is just like when we wake up in the morning and we have a question about anything in life, oftentimes we start with a search of some sort. And the majority of those searches are done on Google. Health actually inquiries start the same way. And the simple question is, where's the first place I start on my journey? That doesn't necessarily mean that I'm not going to go to my doctor, but let me figure out what my options are. And the sponsor of that can be a health provider organization. It could be an insurance company. It could be a government. It could be a third-party company, a brand we've never heard of. It could be anybody. But if people don't recognize the fact that if you just follow the journey, there's an opportunity to use a digital platform to be the first thing people think about to start their journey, then you lose the opportunity to be in that flow. And I would say right now to the provider organizations listening here, if you take it for granted that people are going to come to you as the first stop, you'll find out that there's a stop before you, and anyone other than you could step into that if you don't step into it.
Fantastic. Gentlemen, this has been a great conversation. And I really appreciate you doing this research and coming on the show. It's really been fantastic. Thanks again for your time.
Thanks, Bill. Take care. Bye-bye.
Bye. That's all for this week. I want to thank our guests for sharing their research. If you want access to the report, easiest way to get it is Accenture.com/2020 consumer survey, no spaces. So Accenture.com/2020 consumer survey. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, Sirius Healthcare, ProTalent Advisors, Health Next, and McAfee for choosing to invest in developing the next generation of health leaders. If you made it this far, you're a fan of this show, you can do one of two things for us. It would be greatly appreciated. One, share it with a peer. Just let them know that you're getting value out of the show. The second thing is go out to iTunes and leave a review on the show, and that helps us as well. Please check back on Tuesday for news, Wednesday for solutions, and Friday for interviews with industry influencers. Thanks for listening. That's all for now.